I say continue? This meeting is being recorded.
Yes.
Good evening, colleagues. Just we will wait for 2 to 3 minutes to allow other colleagues to participate or to join the session. So the number is increasing now, so we'll wait for some. I think we are good to go, Dr. Nafis.
Sorry?
We are good to go, so I will start the webinar. Good evening, colleagues. It's a pleasure to have you today in our second module of the School Counselor, Readiness for Changes, which is the ethical consideration in the counseling process, presented by Dr. Nafis Sultana, Senior Counselor in the Higher College of Technology. Before starting the module, just allow me to remind you with the following guidelines. To access the recorded session and get your certificate of completion or certificate of attendance, you need to register in the EDU community portal. Certificate of completion, participants who submit the final reflection will receive a completion certificate. By today or tomorrow, by maximum, inshallah, we will be uploading the assignment for that. Certificate of attendance, participants who choose not to submit the final reflection will receive only an attendance certificate. The deadline for submission will be 8th July 2021, 11:59 p.m. Abu Dhabi time. Translation services is available, and Mr. Omar from the IT team will provide you with the link. You can comment during the session in the chat box, or you can use Q&A if you have any question for Dr. Nafis. Or if she if she wants anyone to participate, you can raise your hand, and Mr. Omar from the IT will allow you to speak. Dr. Nafis Sultana is a senior counselor at the Higher College of Technology with over 20 years of experience in the field. She is a licensed psychologist, social therapist from the Community Development Authority, and has a doctorate in psychology. Her background is in dealing with students, family, and people with determination for all ages over the years has made her a strong advocate of students and students of determination. At HCT, she is primarily responsible to conduct personal counseling guidance, advising students on the individual or group basis, conduct students development workshop, special events, and innovative initiative that increases students' awareness and participation. She is responsible to assist the students in the advising and provision of appropriate accommodation and support. As a health coach, Dr. Nafis provides several support systems to ensure the conditions are right for each student, including students academically at risk, to reach their full potential at each stage of their academic career. Surely, if I want to speak about Dr. Nafis, maybe I will take the whole session talking about her achievements and her great work. She's a friend of mine, colleague. We worked together several years previously in Dubai. It's a pleasure to have her with us today, and I'm sure you will benefit from her session. Dr. Nafis, the mic is yours. Here, there is no floor. It's a mic, so the mic is yours.
Thank you so much, Dr. Fatiha, and I welcome you all. And before everything, I would like to make a special mention to Dr. Fatiha for giving me this platform to address this important aspect of counseling, which is ethical considerations. So thank you very much. And with this, I begin my session. This session would target school counselors' readiness for change, professional development certificate, and the agenda for the session is going to comprise of the APA Code of Conduct or Ethics Code. The Canadian Code of Ethics is going to be addressed in the session, and relevant hypothetical scenarios will be taken forth in the proceedings of the session for better understanding of ethics, and to ensure that you better understand how the ethics as such works. Now, the reason why the American Code of Conduct and the Canadian Code of Ethics is highlighted in this session is because we would all be aware that the psychologists and the counselors in this profession would be receiving licenses to practice from the Community Development Authority. And the CDA would is highlighting the need to understand the APA Code of Conduct and the Canadian Code of Ethics for counselors and the professionals in the field of psychology to have a good understanding of these codes to somehow suit it to the UAE population and in the way it is culturally accepted. Okay, so that's the reason why we are having this in the conversation, in the discussion today. So as the American Psychological Association Code of Ethics highlights that a psychologist's ethical standards and his professional techniques are inseparable, meaning it goes together and it's going hand in hand. So the American Psychological Association is largely talking about the 5 general principles and the 10 ethical standards. So I will be touching upon the 5 general principles and the ethical standards in particular in this discussion, because it is highlighting every fiber of the ethics for the counselors. As such, the counseling profession aims at helping individuals having problems, and these problems often involve real life ethical issues. So all the more reason for a psychologist to understand the principles and the ethical standards to understand the ethics better. Okay, so there are 2 very distinct sections laid by the American Psychological Association, which is the general principles and the ethical standards. In general principles, the 5 principles include beneficence and non-maleficence, fidelity and responsibility, integrity, justice, and respect for people's rights and dignity. Okay, so these are the 5 principles. I will take you much more in detail of what each thing means. So these are the 5 principles that you need to understand better, and the 10 ethical standards. So in the 10 ethical standards, what is important for us to know are, the resolving of ethical issues, competence, which is the 2nd standard, human relations, the 3rd, privacy and confidentiality, the 4th, advertising and other public statements, which is the 5th one. The 6th standard is record keeping and fees, education and training, the 7th, research and publication, 8th, treatment, and then therapy. So all the ethics that largely a counselor or a psychologist would be dealing with is related to these 10 ethical standards and the 5 principles. And of course, once I'm done explaining the 5 principles and ethical standards, I will be touching upon the Canadian Code of Conduct. Okay, so as we proceed, we will first talk about the 5 general principles. So when we are discussing beneficence and non-maleficence, what we mean by this is that a psychologist should aim at doing good and avoid harm. A good example for this is conversion therapy. We as counselors or as psychologists are not allowed to take our clients to the extent of converting them. There we are somehow committing harm rather than doing good, which is not in the best, it is not beneficial for the clients. So this is what we mean by beneficence. Fidelity and responsibility, again, is where it is the responsibility of the counselor or the psychologist to develop trust, accept responsibility of work, and in terms of conduct. Okay, so when what we mean by responsibility and fidelity is the level that you reach to take appropriate action when even other psychologists are not behaving in an ethical manner. Okay, now example is when you engage in behavior which is fostering trust and confidence in your clients. So I'm sure you all are aware that in your process of rapport building with your clients, with your students, we all work towards first establishing that relationship, establishing the trust. You need to communicate that you trust the person in front of you, and the person or the client is also able to confide in you, is able to talk to you in confidence and have that trust in you. So this is very important, and it is the core behavior which a counselor or psychologist has to always subconsciously, unconsciously, and consciously keep in mind. The third aspect or the third principle of the American psychological, the APA standards, so APA principle is integrity. What we mean by integrity is maximizing benefits and minimizing harm through honesty, authenticity, and accuracy. Here, when we talk about maximizing benefits and minimizing harm, a good example here is when the counselor does not misinterpret his services to the public. For example, you might be good in assessing, right? So your specialty could be assessments. Whereas if you are communicating to the public and to others that you are a hypnotherapist, there your integrity can be questioned. So another example of integrity is when you, let's say, commit to handle a particular task. For example, you commit to take responsibility of teaching a particular class. Okay, come what may, unless and until there has been some highly unforeseeable circumstance because of which you are not able to conduct the class, integrity should allow you to conduct the classes which you have committed for. Therefore, a counselor is always reflecting upon how to maximize the benefits for others. The fourth principle is justice. Here, exercising competence, because you as a professional, you have to work on your competence, right? So in justice, you exercise your competence and reasonable judgment. For example, a counselor should understand the feelings of a client when your client is, let's say, addicted to drugs or any sort of other addictions which may not be helping towards the client. Here, we are not there to judge them and punish them or make them realize that they have done the biggest blunders of life. On the contrary, you do not let behaviors which are not socially acceptable or morally acceptable to influence your judgment. We are here to provide the perfect, empirical, competent with due competency, the services which will psychologically make a difference in the lives of the clients. And the fifth general principle here, which has been laid by the American Code of Ethics, is the respect for people's rights and dignity. Through our profession, we might have worked with different populations, with different people coming from different socioeconomic backgrounds. We deal with the determined students, right? And it is our principle or ethics that make us treat them with dignity, with respect, and to make sure we are there to effectively provide them the services that they so rightfully deserve. So now that I have spoken to you about the 5 principles, I have a question for you. Okay, there is no marking for this. You are not going to be evaluated. This is purely for better understanding of the 5 principles. Okay, now the question goes like this. Fidelity is one moral principle that serves as part of the foundation of counselors' ethical decision making. So what does fidelity refer to? A, acting fair in an unbiased manner. B, trust between counselor and client. C, the responsibility to assist in promoting client welfare. D, all the above. So what do you understand by fidelity? It is, I'm sure, for some of you would say A, some B, some C, some D. The correct answer for it is B. Fidelity refers to the trusting relationship between the counselor and the client. Fidelity, it highlights the importance of the counselor fulfilling the commitments that he or she has made to his or her client. Now, the moral principle of justice means to act in a fair and unbiased manner. The moral principle of beneficence indicates the responsibility of the counselor to support the client welfare, which are laid in the in item A and C. Okay, so the answer is the trust between the counselor and the client. Okay, let's move on to the 10 ethical standards. Okay, while the general principles are more general and aspirational in nature, okay, the ethical standards include more specific enforceable rules. So the counselors are the counselors have to abide by certain ethical rules to maintain ethical considerations in counseling practice. Okay, so even in these, as I proceed in these 10 important enforceable rules or standards that is laid by the American Psychological Association. Okay, I have placed many hypothetical questions for your better understanding and the way you are able to link the question to the ethical standard. Okay, so what are the 10 ethical standards? Okay, so when we discuss the 10 ethical standards here, one is resolving ethical issues. Okay, 2 is competence, 3 human relations, privacy, confidentiality, advertising and public statements, record keeping and fees, education and training, research and publication, assessment and therapy. So these 10 standards are actually highlighting the ethical considerations which we counselors have to bear in mind when we are dealing with our students. Okay, so let's move on. The first ethical standard is resolving ethical issues. Here, they are talking about misusing of psychologists' work, the conflicts between ethics and law, organizational demands, okay, what the system requests from you and what is ethically required out of you, okay, informal resolution of ethical violations, okay, cooperating with ethics committees. I don't know, while you are in schools, you are part of ethics committees. So if you are expected to be part of an ethical committee, you need to be playing the role of, let's say, a student advocate, or what is expected out of you without discrimination. So all these include, issues related to unfair discrimination, improper complaints, etc. Okay, so let me talk a little more in detail. When we talk about, let's say, ethical violations, there could be, let's say, ethical conflicts which you may have with the organization, for example, and to make reasonable effort to resolve this, which has to be consistent with your ethical standards. So if you have to resolve the conflicts, you need to play an important role with regard to your organizational conflict. Similarly, there can be ethical violations by your colleagues. For example, you might notice that your colleagues are behaving inappropriately. So depending on the inappropriate action, okay, it is your ethical responsibility to take it to the violation committee if it is substantial harm, or it is, if it is something milder than that, you can have an informal resolution or, discussion with your colleague and resolve it informally, but in a ethical manner. And when you have these requests, as I said, from the committees, you need to belong to the ethical committee to ensure there is, resolving of ethical issues and depending on what is expected from you. And psychologists cannot discriminate against when making decisions regarding employment of staff, regarding evaluation of your mentees, regarding admission of students, for example. You need to be fair and you cannot involve in any form of discrimination. Sometimes you might be on the hiring committee, right? So it's very important that you evaluate the interview in the best manner possible, taking into consideration the qualification, the experience, and all aspects that is relevant for the position, and you take a call. When especially there are personal requests from friends and colleagues, it's very important that you make a decision which is ethical and in the best interest of the organization and the client or the interviewee. Okay, so we will move on to a question regarding the first standard, which is resolving ethical issues. Now, what is it? For example, your co-worker, an experienced counselor or psychologist, recently experienced a difficult divorce. You have noticed that she frequently has been late to appointments with clients and frequently forgets to document the sessions. What should you do in this situation? Report her to the ethical committee for a violation. Collaborate with other workers in your institution to determine how to intervene with this colleague of yours. Address your concerns directly with your co-worker and encourage her to seek support, or just nothing, as her performance is irrelevant to your clients? What do you think is the right answer? Again, my colleagues and I would like to emphasize that there is no evaluation for this. It is just for your better understanding of the standard. Okay.
And
So,
Dr. Nafis, they can answer those questions through the chat. Like
through the chat, of course. Okay, those of you who wish to answer the questions from the chat, please go ahead. I have already, clicked on the answer here. Okay, you can look at the 4 options. Option A is report her to the ethical committee for a violation. B, collaborate with other workers in your institution to determine how to intervene. 3, address your concerns directly with your coworker and encourage her to seek support. And D, nothing, as her performance is irrelevant to your clients. Okay, you can feel free to place your responses on the chat platform. Okay, let's move on to the response. The answer is C. Address your concerns directly with your coworker and encourage her to seek support. Now, why we do this? Because counselors should refrain from working with clients when they know they are impaired due to a personal problem which interferes with the professional performance. So, you are viewing this clearly that it is affecting the professional performance and it is affecting the clients. So it is your responsibility to address the concerns directly with your coworker and encourage her to seek support. Okay, another question. Imagine that you become aware that you are under undue stress and lately have been subjected to emotional abuse shortly after you begin treatment with the client. What is the best course of action? Number 1, the A is seeking help. 2 is engage yourself in training. C is supervision, seek for supervision. And D is referring out. What do you think is the best course of action for that you need to undertake in a scenario like this? You can place your responses on the chat, please. Okay, so would you like to see the answer? Great. Okay, the answer is A. So when the counselor is unable to effectively perform his or her job, he or she should seek help. Evaluate whether he or she is fit to continue with work-related activities, and it is the counselor's ethical responsibility to the client to ensure that he or she has the capacity to provide adequate services to the client. So until the psychologist is fully capable of serving his or her clients well, the counselor should not see the clients on any level. So the fact behind the standard is that we need to ensure that we are placing ourselves in a situation where we do justice to our clients, and we need to be capable of providing the best course of intervention for our clients at every level. If we are having personal issues and it is affecting our judgment and our capacity to serve the clients, we have to refrain ourselves from providing the counseling, and on the contrary, seek for help ourselves before we see other clients. Let's move on to boundaries of competence, which is standard 2. So as per the boundaries of competence, one should understand that to provide services, teach, or to conduct research with populations in the areas within the boundaries of competence. Now, we all as professionals, we have to be fully aware that we need to practice based on our background, based on our education, our training, our experience. Time to time, seek for consultation, seek for supervision, go for professional development sessions, which will benefit and add on to our skill set. Now, this is very important, and it should be done on an ongoing basis. If I have, let's say, prepared, I have done my bachelor's and master's, or a doctorate, for example, I am not done for life. As psychologists, as counselors, it is our duty, our responsibility, and our ethical responsibility, I would say, to keep ourselves abreast with the latest skills, knowledge, and experiences that will help us serve the clients in the best manner possible. And we need to keep our experience within our boundaries of competence. Now, for example, if I'm an educational psychologist, I cannot get into the clinical and the medical aspects of counseling, or the spiritual aspects of counseling. Right? So one needs to understand our boundaries of competence and stick to our boundaries of competence. To provide the services, let's say, to new populations, or you need to use new techniques, what is it you need to do? For example, you have, let's say, taken a course on cognitive behavior therapy, for example, and you have just completed the course, and you want to try it on a new set of clients. What is the best way to do it? You have taken the course, right? But can you easily get into the entire intervention program of CBT? Well, that is something that you need to introspect, because psychologists have to have relevant education, training, and let's say a good amount of study and experience to conduct intervention programs. Therefore, if you are just, let's say, new to a program where you have just taken a course, maybe not a maybe attended a one-day seminar, okay, and you get excited that CBT is extremely valuable and beneficial for the clients, and you want to try CBT. There would be a large or a massive difference between a one-day seminar that you have attended on CBT and a complete CBT course that you have taken, mastered, undergone the necessary training before you venture into to practicing therapy, which is related to cognitive behavior. So it's very important that the psychologists take relevant education, get sufficiently trained and supervised. Now, for example, let's say you have taken the course, but you are not completely confident to run the therapies or the series of sessions for your clients. So what do you do in that case? You look for supervision. With the help of a supervisor who is an expert in CBT, you can continue, because you already know the clients, for example, and you can continue with sufficient supervision. You will be able to undertake whatever course of intervention that you need to. So you need to establish your work based on the scientific and the knowledge of that particular discipline. Okay, so this is about competence. I hope this is clear to you all what we mean by boundaries of competence. Now, this is something which which we walk with, which we talk with, because always our qualification, our experience, our background, and our specialization will talk for the kind of counseling practice we have with our clients. Coming to the question session for better understanding. Imagine that you have a client who would like to try hypnosis, and you feel that she would benefit greatly from it. You know that she's going to benefit with hypnosis. However, you only recently learned the technique and you do not have experience applying it to your professional work yet. So what is the best course of action that you can take? Whether you will take to consultation, or will you take to referring the client out for hypnosis, or would you, get into more training, or would you seek for supervision? Okay, so somebody says A, somebody says referring out, somebody says not C. C, okay, someone says C. B, okay. Okay, great job, guys. Let's look for the answer. The answer is D. Supervision is the best option. Since you have already established rapport with the client, you know the client, right? So referring out is an inappropriate option. You have been trained in the technique, right? So the most effective decision is for you to seek supervision when first applying it. So once you seek the supervision, you already have the training. You've got the training in hypnosis, and you believe your client is going to benefit from it, and you know the client very well. So you have already built the rapport. You have already established your trust with your client. So with you can inform the client that you will be seeking for supervision, and you can go ahead with the hypnosis. So the answer is D. Okay, so for all those who got D as the answer, congratulations. Great. So it's nice that you are able to place your responses as well. So this makes it makes an afternoon session more interactive. Thank you. Okay, so standard 2 of boundaries of competence, I'm going to continue again because there is a question based even on delegating work to others. Okay, delegating responsibilities to employees, supervisees, research assistants, interpreters, and others. Also, is there are boundaries attached to it when it comes to your competence, because when you delegate, you definitely are in a position of power. So what we need to keep in mind is delegation is good, but when you can delegate, when number one, it does not have multiple relationships with the recipient. What do we mean by multiple relationship? It is with the let's say the it is when the services could actually interfere with one's objectivity. Okay, when there is let's say a multiple relationship with your client, it is going to somehow affect the effectiveness of the relationship and also the objectivity. Why? Because you are already in another relationship with the client. Now, what do I mean by this is your let's say your client is also your dentist. Okay, so there are more than one relationships. where as a counselor and a client, your relationship would be very different from your, let's say, your client who is also the dentist. There, you know, the relationship can move into a little bit of manipulation. So this is not the best. And even, for example, if you, let's say, make friends on Facebook and LinkedIn with your client, for example. Okay, so these are examples of multiple relationships. The other area where you cannot, you should be very careful when you delegate responsibilities is when the person has adequate competence to provide the services independently or while being supervised. This is, you know, if you are able to do it yourself, okay, and if you are able to do a task yourself, then you don't delegate it to, let's say, your supervisee or your assistant to make your job easy for you. Okay, because there is a relationship of you know, superiority and inferiority. There it is not an ethical way of you know, delegating work. And the third, or the third aspect is when the psychologist ensures that the person provides the services competently. So if that is not possible, for example, like if you know that when you are delegating, the person is not competent to do it, then you don't delegate the responsibility to somebody who cannot deliver as competently as it is expected to be. Okay, so now coming to the question. A senior counselor or a psychologist at a school agrees to train his juniors so that they can run his therapy sessions so that he doesn't have to do it. So which of the following statements is correct? The senior counselor's actions are unethical because he is exploiting his juniors. B, the senior counselor's actions are unethical because he is misinterpreting the role of his juniors. C, the senior counselor's role is ethical because he's providing training opportunities to his juniors. And D, the senior counselor's actions are ethical because the clients will not have a problem. You can place your responses. A, C, B, C. Okay, let's move to the responses to see how many of you got it right. And it's fine even if you don't have to. The answer is A. Congratulations for all those of you who got it right. The senior counselor's actions are unethical because he's exploiting his juniors. Now, why is he exploiting his juniors? It is something that he can or he is supposed to do. But just because he doesn't want to do something, he is making his juniors to do something which is his job. So when he is delegating there, it is his responsibility to pay his juniors for the therapy sessions that they are undertaking. So that is being fair and ethical. But if he is getting them to do it so that he can avoid it, it is highly unethical. So counselors are ethically obliged to refrain from exploiting supervisees, clients, and anyone else with whom they have professional contact. Agreeing to train juniors interns simply so they can fulfill a duty that the senior counselor dislikes is unacceptable and unethical. While the juniors are dependent on the senior counselor or the psychologist for their evaluation, for their training, for their everyday tasks, they would be compelled and obligated to do what the supervisor demands out of them. So this is an exploitating relationship, which is unacceptable and unethical. So the other aspect of with regard to the boundaries of competence is personal problems. So here I would like to mention that psychologists are required to refrain from practice when they are going through personal problems, and if it comes on the way of a psychologist's effectiveness, and also take appropriate measures when they become aware that there is a personal problem that is negatively affecting their practice or their professional activity. So when the person becomes aware that it might negatively affect the ongoing activity, a good example is when a counselor needs to decide that he or she needs to seek consultation, okay, or to whether he needs to limit the practice or suspend his practice or probably terminate his practice. So you need, as a counselor or as a psychologist, we should all be aware that we are also human and we can go through difficult personal issues in life. So you need to use your rational judgment to understand the severity of your personal issue, whether you can just seek some consultation and help yourself, or you need to limit your practice for some time, or you probably have to suspend your practice or even terminate your practice if need be. Imagine you are just not physically or mentally in a position to practice. What happens there? You will not be able to give it your best. In that case, you may have to terminate your practice temporarily, or suspend it, or even terminate with the client itself for the rest of the period, or refer the client to somebody else. So this is very important, and this also comes under competence. And ethically, morally, we are, we need to take appropriate measures to ensure that personal problems do not come on the way of our professional practice. Okay, so we will move on to the next standard, which is human relations. Now, ethical requirements related to discrimination, or let's say harassment, or multiple relationships, or let's say informed consent or interruption of services are all within the realms of standard 3, which is human relations. Now, discrimination is based on let's say age, gender identity, race, ethnicity. Wherever we practice, it is prohibited by all means. While culturally, a lot of us counselors and psychologists, we need to be sensitive about the sexual harassment part. It can, in whichever form, it has to be, handled with great sensitivity, and it can involve single severe behavior, or even multiple persistent behaviors, which we need to deal with in a very, very sensitive manner. Okay, when it comes to human relations, avoiding harm is also, equally important, where we need to take reasonable steps to make sure any kind of harm is avoided to clients, supervisees, students, and and others with whom they work, and to minimize the effects of harm. As counselors, as practitioners, we need to do everything within our capacity to ensure that we try to avoid any form of harm to the clients. I would have spoken to you about multiple relationships, even with regard to competence. Again, multiple relationships occurs when the psychologist has a professional relationship with a person, and at the same time has another professional relationship with somebody who he or she is closely associated with. And also, a multiple relationship is when you promise to enter into a relationship in the future with that person you have been closely associated with. Okay, there are lots of standards and details pertaining to this, which we would probably require another session to talk about. But for the moment, I would say that it is just important and at the same time relevant for us to understand that multiple relationships are a no-no. A professional relationship with a client is it's just a one time or a one professional relationship, not another parallel one at the same given point of time. Okay, so even with regard to conflict of interest, when we are taking in or accepting a professional role, okay, which is kind of impairing our objectivity, or competence, or effectiveness, or even exposing the person or the organization to harm or exploitation, should be taken into serious consideration. We have to refrain from any kind of conflict of interest. And informed consent, again, we have to be very much aware of, because informed consent with the client at every given stage, in every given activity, be it a research, be it let's say a professional service, or whether it is an assessment or in therapy, informed consent is very important. What goes into informed consent is letting the client know in reasonable language the kind of professional services that you are offering. It can be verbal or it can be written. Now, a lot of counseling sessions are happening on Zoom, are happening online. Since the time, actually telecommunication was, telecounseling was, a thing of the future. But somehow the COVID and the pandemic has advanced it to today's style of conducting counseling sessions. We all as counselors, we all as therapies are conducting counseling on Zoom, on Cisco Jabber, or rather on the telephones, or on Microsoft Teams, for example, right? So even an informed consent, I'm sure as therapists you have all developed your own formats. You can have your own formats of getting informed consent of your clients, but it is very important that you get it either verbally or written, or now we are doing it online. So like in the institution where I work, we have an online informed consent for our students, where we get them to first read, agree, and then it goes on to the counseling session, where we get into the interaction for psychological services. Okay, so this is a part of or the importance of standard 3, which is human relations. And with regard to interruption of services, it is important to make reasonable efforts to plan for facilitating services, especially when psychological services are interrupted. For whatever reason, you are not able to continue, make sure you have referred it without interruption to another colleague or to another center where the client does not get disadvantaged. Or if you are interrupting a service, ensure that you are making a backup plan, or you are informing the client, and you get back to it. So whenever there is an interruption of service, please ensure that you make reasonable efforts to facilitate the services in your absence, or come to an understanding where the individual can, or the client will be able to come back to it. Okay, so coming to the exciting bit of the session, which is the question and answer with regard to multiple relations in therapy. What is an example of multiple relations in therapy? A, your client is your dentist. 2, your therapist is also married to your sister. C, all the above. D, none of the above. Come on. C. Okay, I guess there is somehow a unanimous way of answering. This is seeming very straightforward and easy, right? But yet, sorry, there is 1 minute. I think there is. Okay. Okay, the answer is A. Dual or multiple relationships occur when the counselor has simultaneous relationship with a client, such as a client being your client and also your dentist. Here, the boundaries are crossed when such relationships occur. Okay, and in small towns, sometimes we need to be aware that these kind of relationships are unavoidable, because it is a small place and there can be an overlap of relationships. Okay, so look at this. When your therapist is also married to your sister, most of you have said yes. Now, when we are talking about multiple relationships, your B is also right and your C is also right. So for those of you who have said C as the answer, you are right. Those of you who have said A is absolutely right. Okay, and those of you who have said B are also right, because your therapist is married to your sister, meaning he or she is related. Okay, so there are dual relationships. Now, next question. Which of the following can protect a supervisee from harm? A reputable clinical supervisor. B, a caseload of easy clients. C, an empathetic co-worker. And D, a supervisor's ample training and clinical supervision. Come on, let's look at your responses here. Okay, let's quickly move on to the answer. The answer is, for all of you who got D as the answer, congratulations. The supervisor's ample training in clinical supervision is the answer. Clinical supervisors are responsible for ensuring that both supervisees and their clients are protected from harm. So a supervisor needs to have ample training, as this can protect both the supervisee and the client. So before you become a supervisor, make sure you have ample training and experience in the field. Okay, we would move on to standard 4, which is privacy and confidentiality. Maintaining confidentiality is a very important aspect of the ethics for counselors. So it permits disclosure of confidential client information. So privacy and disclosing confidential information is a very important aspect to ethics. So now, most importantly, what we need to know is that in disclosing confidential information, which is, let's say, permitting the disclosure of confidential stuff from the client, one has to you need to have proper authorization or appropriate authorization to release the information from the client. That's why I spoke about informed consent. You need to take it in writing, or you need to take the consent of the client to share the information with anybody, unless and until, until then it is confidential. And without authorization, only if it is mandated by law, you are permitted to share information. Okay, so here in this region particularly, where we are dealing with minors, okay, we need to be very sensitive about the confidentiality aspect. Okay, the right to confidentiality does not extend to clients who are minors. So when a minor's parent or legal guardian has the right to information disclosed by the minor, the good strategy is to discuss confidentiality of all parties and come into an agreement in the beginning of the therapy itself, what information you're going to share and what you're not going to share. So especially in let's say school counseling, where you would be dealing with guardians, it is very important that you speak to your students in the beginning of the therapy itself, that the students' parents or the local guardians would need to be informed of A, B, C, and D. So once you have this very clearly laid down in the beginning of the therapy, it will make it that much easy, and even your students are going to trust you and confide in you when it comes to difficult emotions or the challenges that they are experiencing without any difficulty to express themselves, because they know at some point of time you are going to be keeping the parents or the family in perspective. Okay, now with regard to group therapies, okay, it's very important that you describe clearly the roles and the responsibilities of all the parties, the names of the participants, and also the limits of confidentiality should be mentioned, especially when you are engaging in group therapy with your students. It is very easy for the information to go out of the group, because it's no longer one-on-one. So it's very important that as counselors, as psychologists, we have a very well-developed confidentiality policy in place that is explained to all the members of the group in the beginning of the therapy itself. The last few years, last couple of semesters, we have been engaging ourselves in a lot of telepsychology. Well, there are a lot of risks and challenges that you may have experienced with regard to the confidentiality information of confidentiality of the clients, with regard to record keeping, and sometimes even delivery of the services. It is you are far from having a face-to-face interaction, which where the bonding is better with the students. Okay, so in telepsychology, one has to be very careful and mindful about the confidentiality aspects and the risks that are involved in the confidentiality part, because the information can very easily be shared when it comes to workflows, when it comes to online recording of data. Okay, so again, to the interesting aspect of the session, here is a question for you. As a counselor, it is important for you to inform the client of these things during your first session. Now, what are those things? Client rights, confidentiality and diagnosis, or client rights, confidentiality and fees, or C, confidentiality, fees and treatment plan, D, therapeutic approach, treatment plan and diagnosis. While all this is important, I would like you to think about what is important for your client to know in the first session, right? Imagine you're meeting your client for the first time in the first session. What are the aspects that your client needs to be aware of? A, client rights, confidentiality and diagnosis. B, client rights, confidentiality and fees. C, confidentiality, fees and treatment plan. D, therapeutic approach, treatment plan and diagnosis. So I see a lot of responses coming in the form of A, C, A, B. Okay, we'll move to the answer because I still have a lot of good questions for you to help you understand better. So we will move faster. Okay, please bear with me. The answer to it is B. So for all of you who said B as the answer, congratulations. Okay, it is essential for the therapist to provide a new client with information regarding the client rights, confidentiality, and the fees. While in many schools, it's free of charge. So I'm sure you can also talk a bit more about the therapeutic approach. Okay, and the client might be going forward with. Okay, and also diagnosis. But usually, when a psychologist is getting involved with a client, it's very important in the first session itself. So if it is free of cost, you inform the student that your sessions are free of cost. So these are the three aspects, very important, or the most important aspects that a counselor has to make sure you have communicated to your client in the first session. Okay, another good question for you all. Confidentiality is an important aspect to a therapeutic relationship. Why? A, it helps clients feel safe in treatment. B, it encourages clients to share material that will be painful or embarrassing. C, it helps counselors trust the client. And D, both A and B. Okay, I think you are all mentioning both A and B as the answer, most of you. And yes, it is a unanimous answer. Brilliant. So the answer is, okay, so the answer is D. I think you all got it right this time. Bravo, you are getting better and better and better. So confidentiality is an important aspect of therapeutic relationship because it helps the clients to feel safe in treatment and also encourages them to share sensitive material. It helps the client to trust the clinician, not the other way around. So at the same time, confidentiality has its limits. For clients who are minors and those who present a danger to themselves or others, or those who have abused a child or an elderly person or a disabled person. So there we need to look at things a little differently. Next, Standard 4, again, we'll continue talking about disclosing confidential information. It permits disclosure of, confidential information, as I told you already, when it comes to the appropriate authorization to release information from the client or the client's legal representative, or without authorization as mandated by law. So the psychologist here can consult with colleagues about the clients, but requires them not to disclose identifying information about the client to a consultant without the client's authority to disclose information that's necessary to achieve the purpose. So only that information that will help the client to reach the purpose is what can be discussed by psychologists, by the psychologist with any other colleague, without revealing the vital information of the client that can be exposing the client. Okay, so again, another question for you. If a counselor is aware that a client, sorry, there is an I here, it is. So if a client is aware that a client, if a counselor is aware that a client is engaging in using illegal drugs, is the counselor bound by law to notify the proper authorities of this activity? I'm reading the question again. If a counselor is aware that a client is engaging in using illegal drugs, is the counselor bound by law to notify the proper authorities of this activity? A, no, the counselor should try to get it, try to get in on the action. B, no, the other way, the counselor should break confidentiality. Confidentiality there is an error here. The only way the counselor should break confidentiality is the client's activities will, if the client's activities are likely to do harm to himself or another person or property. C, yes, any illegal activity should be done anonymously, so as not to lose the trust of the client. And D, yes, but it should only be done anonymously, so as not to lose the trust of the client. Okay, so I'm taking you straight to the answer. The answer is B. If the counselor is aware that a client is engaging in illegal drug use, the counselor is not bound by law to notify proper authorities or notify the activity. The counselor should only break confidentiality and notify the proper authorities if the client's activities are likely to harm himself or herself or another person or property. So once the client trusts his or her counselor, the counselor might ask if he or she would like to help in the what is the type of help he might like to have in the drug issue. And the counselor might cite health, financial, or legal reasons as incentives to get rid of the habit. So the counselor is not bound by law, but the counselor can urge the client to see how he can, talk about it and help himself. Okay. Next, when a counselor is seeing clients under supervision, what does the client need to know about the arrangement? If the counselor is seeing clients under supervision, that is, you are seeking supervision time to time, what is it that your client needs to know about this arrangement? A, how often the client meets with the supervisor. B, that the counselor is being supervised and will be consulting with a licensed therapist or a co-counselor to discuss the client status. C, the client does not need to know that the counselor is being supervised. D, none of the above. So you can place your answers. Okay, I see some B's and C's coming in. Okay, let's look at the answer. The answer is B. And yes, to all those of you who have mentioned B as the answer, the counselor will need to receive consent to release information from the client in order to discuss counseling progress with the supervisor. So it is very important that you as a counselor inform your client that you will be supervised. So only after you receive the consent will you be able to seek supervision. It is important for clients to release the counselor is being supervised by a licensed therapist and what this entails for the client. So the client needs to know how, in which way are you going to benefit the client by you seeking supervision. It's not necessary for the client to know how often the counselor actually meets the supervisor. Though if they ask, you can tell, but it is not a mandatory item. It's enough if you receive the consent that you will be seeking supervision. Okay, another question quickly. Counselors have a responsibility to protect clients who threaten or attempt suicide or any form of physical harm against themselves. This is called A, responsible reporting, B, duty to warn, C, duty to respond to threats, and D, breaking confidentiality. So let me see how many of you are able to get this right. Okay, I'm going to take you to the answers to take you to the answer. Okay, so the answer is B. Duty to warn is the duty to protect clients who present a danger to themselves or others. So keep in mind that when you are, whether you're dealing with minors or you're dealing with majors, when you know that there is an attempt to suicide and when you do your risk analysis and when you know that the individual is attempting suicide or he is suicidal or he is extremely depressed and is about to cause some form of harm to himself or herself. What we mean by duty to warn is where you need to know when to escalate the matter. There you are allowed to breach confidentiality or break confidentiality. You are supposed to escalate the matter, whether it is informing the family or whether it is informing your management, right, wherever you work. So depending on how you need to action immediately will sometimes fall for breaking confidentiality, and the decision to break confidentiality is not an easy one, and it has to be made only in a rare circumstance, especially after probably you consult with your supervisor when you are faced with an issue which you do not know how to respond to. But if you are sure that if there is cause for life, there is cause for danger to one's own self or to somebody else, right? There you are allowed to breach confidentiality. I'm moving to the fifth standard, which is advertising and other public statements. Please, as counselors and psychologists, it's very important that we are sure about the credentials, the experiences, the services that we offer to clients. There should be no fabrication of any information of any sort, whether it is preparing something on your CV which is not true, or you produce information about your licensing which is not true, or an advertisement which is talking about a specialization which you are not thorough in. These are prohibited in under standard 5 of the ethics. So please make sure that you state authentic and correct information in your public listings. With regard to client testimonials, please, we need to all understand that psychologists are prohibited from requesting for testimonials from clients who are in therapy, because they are under influence and they are vulnerable to a particular circumstance, and they will be forced to give good testimonials. Therefore, please, we need to bear in mind that we cannot request any form of testimonial when the client is under therapy at that given point of time. Okay, and with regard to in-person solicitations of business, counselors are strictly prohibited from engaging in any kind of business with your potential client, and who are again vulnerable to your therapeutic methods. So any form of business, any form of testimonial during therapy, or any form of fabrication is extremely prohibited according to the ethics. Moving on to the 6th standard, which is record keeping and fees. As counselors, as therapists, it's very important that we maintain and disseminate and dispose records, in an efficient manner. We need to ensure that we need to have the records of the proceedings of the therapy, so that even in between, if we have to terminate the services, or if we have to, let's say, if we have to, pass it on to another counselor, the person who takes over should not have it should not give a compromised deal to the clients. Therefore, it's very important to maintain records of the sessions or records of students in order to bring the best service effect to the client. In record keeping, as per the guidelines, as I have mentioned over here, that a counselor or a psychologist should consider retaining full records until 7 years after the last date of the service as well for all the adults, and for 3 years after a minor reaches the age of majority, whichever is later. So this is the extent to which counselors or psychologists are mandated to keep or save records of clients. Yes. Okay, so I'm going to move faster regarding the fees as well. The earlier you talk about it, the better it gets for the client, so that he is not into a surprise later on, and he or she should be able to afford the fee if you are making your services paid. Okay, actually this standard even prohibits psychologists from holding any kind of information, okay, purely because the client has not paid the fees. Okay, so I will move on to the next standard, and I would probably come back to the questions from standard 6. Okay, so I would like you all to understand all the 10 standards of the APA. And in standard 7 of education and training programs, it's talking about how important and relevant it is for you to have the relevant or the appropriate education and training, which is necessary for you to have to conduct individual therapy or group therapy, or regarding the student disclosure of personal information, description of education and the training as such, right? And then we are looking at taking reasonable steps that we need to establish education and training from time to time. Okay, and making sure that we are providing the best form of therapy to our clients. When a supervisee, okay, exhibits, for example, a problem behavior. Oh, one second.
No, nothing is there, Dr. Nafi. It's just Dr. Smith is trying to join with us, so no worries, because
Okay.
that's giving the sound.
Okay, okay. I was just wondering if
you have 5 to 10 minutes, because there is few questions also from the participant.
Okay, okay, sure. So I'll make it fast. So So with regard to education and training, it's very important that we need to ensure we are providing the feedback to our supervisees and our students, especially with regard to supervision. An issue with the, okay. I'm moving on to the informed consent. With regard to research, it's very important that the purpose of the research is highlighted to the participants, and the participants have the right to decline. And you need to, in your consent, discuss the research benefits, the limits of confidentiality, and to whom you can contact. And with regard to the deception in research and use of animals, we need to take clear steps that there is that can be that deception can be used only when certain conditions are met. Okay, so here, and as psychologists, we are prohibited from fabricating any data with regard to research. The psychologists have to take credit only for the work which they perform and which they have substantially contributed to. And I'm moving on to standard 9, and we have, I think, 2 standards, which is 9 and 10, which is talking about assessments and therapy. With regard to assessments, techniques and results, psychologists should make sure that their conclusions are based on sufficient information. You need to take the client through the standardized testing, making sure that the tests are sufficiently communicated to the clients, and you need to base your results on substantial, calculation, or the assessments that you have conducted in a systematic manner. So when psychologists should also use the assessment techniques so that the purpose is appropriate. You cannot use let's say an intelligence survey for a person who is having let's say a vision impairment, for example. Okay, so you need to use appropriate tools. Allowing unqualified individuals to use psychological assessments and techniques are again prohibited. So and even psychologists are prohibited from basing any decisions on obsolete assessments, assessments which are irrelevant, old, and which are not in use. So therefore, psychologists should make reasonable steps to explain the assessment results to the clients in great detail. Okay, again, talking of informed consent, whichever assessment tool you are using on the client, make sure you take the consent before you use the tool. Okay, and the last standard is consent to therapy, informed consent to therapy. It is the same, where you need to obtain informed consent as early as possible before you begin the therapy or in the beginning of therapy itself. So when you are providing the therapy to the clients, psychologists must proceed with caution and sensitivity with the therapeutic approaches. Make sure you conduct only the therapy you are experienced in. And whenever you want to terminate a therapy, okay, make sure that the client no longer is benefiting from your therapy, or he has benefited enough and he needs to move on. Okay, so termination of therapy should also be carefully calculated, decided, and taken forward. So I'm going to quickly take you through a question which but before that, let me just complete the Canadian Psychological Association. This is again very, very easy. It's just 4 principles. The first principle, which has maximum weightage, is again dignity of persons, respect and dignity, which we have already seen in the the 5 principles there. okay, in the American Code of Ethics. The second principle is responsible caring. The third principle is integrity in relationships, and the least weightage, which is among the four principles given, is responsibility to society. There, as a psychologist, we first have to ensure that the maximum weightage is given to the respect for individuals, and we need to take care of having the trust, the bonding, the rapport building, and making sure we care for the individuals responsibly, and we deal in our relationships with our clients in high integrity and with the responsibility of society. It is first the client over the demands of the society. So this is the fourth principle, which has least weightage. So with this, I'm concluding my session. I'm sorry I was not able to take you through the many questions that I had in mind for you all due to time constraints. I just had a couple of questions in case there is time, or otherwise I can take the questions from the audience. Dr. Fteha, what would you advise?
Yeah, we can go with those multiple choice questions. I like them. It's nice ones.
Excellent. Okay, so I will go with it. So here's the last couple of questions for you. When a person is believed to lack capacity in making clinical decisions, the psychologist should A, ask family members to help them in deciding how to proceed. B, check to see whether there is an identified guardian. C, continue as planned and check on informed consent later in the day. And D, presume the person has capacity until proved otherwise. Okay, vote for your answers. Okay, we'll quickly move to the answer. Excellent responses for all of you who said B, to check whether there is an identified guardian. When working with people who are not able to decide, counselors should take responsible steps to protect the client's rights and welfare. I'm taking you to the next question quickly. In a group therapy situation, okay, choose the best answer. A, at the onset of therapy, group members must sign a binding contract to maintain confidentiality. B, the counselor should discuss the benefits of maintaining confidentiality with group members. C, group members have no obligation to maintain confidentiality. And D, group members are legally obligated to maintain confidentiality. Come on, the voting starts now. Okay, so here's your answer. The answer is B. The counselor should discuss the benefits of maintaining confidentiality with group members. Group participants do not have a clearly defined ethical or legal obligation to maintain confidentiality. The best course of action would be to discuss the benefits of confidentiality to individual members and to the group as a whole, so that when a group is together, they identify their purpose, their goals, and make sure it is maintained in a confidential manner, and the confidentiality is maintained. Okay, so I think this is the last question. I'm sorry I'm taking a few extra minutes from the session. The holder of privilege is usually the A, counselor, B, client, C, parents or guardian, D, both the client and the counselor. Who wants to know the answer? Can somebody raise your hand? Whoever.
Mr. Mujahid, there's just 3 or 4.
So what is the answer? It is the client who holds the privilege unless he or she is a minor or a legal guardian, or has a legal guardian. So the answer is the client. And if it is a minor, you know who it is. Okay, so thank you very much for being so proactive and interactive in this afternoon session. I really, really appreciate, and it's been such a pleasure being a part of this fantastic, interactive team. Dr. Fteha, thank you very much. I would like to conclude the session by just a quote from the scientist. The most important human endeavor is the striving for morality in our actions. Our inner balance and even our very existence depends on it. Only morality in our actions can give beauty and dignity to life. Thank you very much.
Great, thank you, Dr. Nafis. There's two questions on the Q&A and one comment. So I will read them for you.
Sure.
And feel free to answer them or no. The first question from Carlo, sorry if I'm saying the name wrong. Good evening. How to be licensed counselor in UAE?
Okay, the answer to this is number one, you need to contact the Community Development Authority. They are the licensing authority in the UAE for psychologists and counselors. There are, four or five licenses that they are offering, which is a special educator license, which is a social therapist license, which is a social counselor license, and there is a social worker license, if I'm correct. So you need to contact the Community Development Authority, and there is an application that you need to fill, which comprises of your highest degree and data which is relevant to your experience, to your qualification. And once you submit that, they will take you through a licensing exam appropriate to your qualification and experience. And once you pass the exam, you become a licensed therapist.
Okay. The second question is from Ms. Fawzia. She is saying, with regard to the right of information of a minor's parent, if a minor is abused by parent or guardian, how can we deal? How can we deal with it? Yeah. Or how can we deal with it? Yeah.
Okay, clearly the minor is, see, usually what happens is with minors, you definitely are in contact with the guardian and with the parents. And in this case, where the minor is being abused, you will have to escalate the matter to a higher authority. It could either be, we have, I think the Women and Children's Community Development Center, which is working towards, counseling, therapy, and interventions. And from there onwards, you can, take your management into into confidence and address it with the parents if you believe that it can be of help. 3, you can, if there are siblings, elder siblings, you can take to family counseling therapy. And this definitely needs escalation. It is not something that you can handle just at a client level. So this will, because it is, duty to warn. You have ethically, you have the duty to warn. So it is hurting an individual, or the individual is hurting somebody else, then you need to escalate the matter to a legal authority or to the higher management, where intervention beyond you is required. I hope I have answered this.
And I think also, like I think Alia, she mentioned that in UAE also there is a lot of laws related to children abuse, Wadima's law. So those cases maybe can even report it. Even they can deal with it confidentially through some specific centers in UAE. Yeah. Thank you, Nafis. There is a comment maybe there is a question within this comment. I'll go through it from Merla. I think we have to consider the personal problem and help or support the person to solve the problem. We are working with human beings. We cannot separate personal problem. We don't tolerate, of course, but we have to support colleagues.
Yes.
Yes, that's a comment from Merla. Thank you, Merla. Great. So I'm thinking, Dr. Nafisa, I'm thinking Lalian and Nahil, they are raised their hand. If they have any question, I will allow them to speak. I'll allow Lilian first. Lilian, you are allowed to speak. Just you need to unmute yourself and go ahead. You need to unmute yourself, Lilian. Hope I'm saying the name right. Lilian, you need to unmute yourself. Maybe she's having an issue with her mic. So we will go to Nahil until Lilian fix her issue. Nahil, you can unmute yourself and talk, please. It seems it's the same issue with both. Omar, can you help in this?
Unmute.
Yeah, Nahil, yes. Nahil, go. Still the same, yeah. Nahil, she put her hand down. I will allow Nada, maybe Nada, if I hope it will work with her. Nanda David, you are also permitted to speak. You need to unmute yourself. Omar, you are still with us?
Yes, doctor. Yes, I'm there. It's already allowed Nanda to
So
speak.
it's from our side or from their side?
She has to ask. She has to unmute herself.
She has to unmute.
Unmute. So it's from their side. They need to unmute themselves.
Yes.
You are. So I will go with the fourth one. Nirobam. Allow her to talk if she is. It's still, I think, the same. All of them, they are having the same issue. So colleagues, you need just from the mic to press on the mic so that you will be able to speak. It's just unmuting yourself.
It's the first icon on the left corner.
Yeah, seems all of them. So it's fine. But if there is a chance to write it on the, thank you, Carlo. Thanks a lot, Carlo. If you want a question, you can write it just in the, on the chat. It seems that there is an issue either from their mic. I don't know. Like this is maybe a technical issue. So, yep. So we'll end it here. I don't find the word to thank you, Dr. Nafisa. It's really appreciated, and thank you for the great and informative session. I'm sure the team, like also myself, enjoyed it. It was informative, a lot of information, and I'm sure they benefited from it. And even the multiple choice questions are tricky ones, and the level of application. So thank you for that. And sure, we will be also having a lot of collaboration in the future in our coming professional development certificate. Thank you, Dr. Nafis, again. Thank you, colleagues, for being with us as a panelist today. And thanks for the attendance, for their great participation. Thank you all.
Thank you. Thank you.
Thank you, Dr.
Thank you all very much. Thank you.
Thank you.
Bye-bye.
Thank you, Dr. Nafisa. Thank you.